Welcome to the educational recording for the topic Screening for Fall Risk. The Catch Rural Falls program is supported by the Nebraska Department of Health and Human Services Office of Rural Health through the Medicare Rural Hospital Flexibility Program. The content of this presentation is solely the responsibility of the presenters and does not necessarily represent the views of our funding source. I am Dawn Venema, and Vicki Kennel and I form the UNMC Catch Rural Falls team. We are both faculty in the College of Allied Health Professions at the University of Nebraska Medical Center. I'm a physical therapist, and I bring the clinical perspective of fall risk reduction to our team. Vicki is an industrial organizational psychologist, so she brings that unique viewpoint to our team, given her expertise in quality improvement and organizational science. The educational objectives for this recording are first, to differentiate fall risk screening and fall risk assessment, and second, to describe strategies to screen for fall risk. First, let's differentiate between screening and assessment. This slide has the definitions of these two terms. Screening is defined as the identification of patients at increased risk of falling to determine if additional in-depth assessment of risk factors is needed. The definition of assessment is the identification of specific risk factors to guide intervention. I want to emphasize that screening as defined is meant to be quick. You are just getting a snapshot of the patient to see if you need to take a deeper dive and assess for individual risk factors so that you can more closely figure out why, and that why is going to guide your intervention with the patient. What does the evidence recommend for screening in terms of who, when, and why? The Centers for Disease Control recommends that all older adults are screened at least once per year. This is often done as part of an annual physical, such as the annual Medicare wellness visit, or it can also occur when the patient happens to come in to be seen for something else. Screening can be done prior to the appointment, such as over the phone or sending questions to the patient in advance through secure online patient portals. Why is it important for healthcare professionals to initiate screening versus waiting for the patient to mention a fall? Well, it's because most patients aren't going to bring it up themselves unless prompted. Some people see it as a normal part of aging. Some don't realize it may be related to their health. Some are in denial that it happened. Others feel embarrassed and have fear that it's going to trigger a loss of independence, such as having to move out of their home. In reality, though, as healthcare professionals, we want to catch these issues as early as possible so we can maximize people's independence and their ability to stay in their homes. The Centers for Disease Control has done a lot of work to help healthcare professionals be guided in fall risk management. If you click on these words on the slide, it's going to take you to an algorithm for screening, assessment, and intervention. It's basically a decision tree that walks you through the clinical management of fall risk. This algorithm is just one tool available through the Stopping Elderly Accidents, Deaths, and Injuries Initiative website, also known as STEADY. Here is a screenshot of the algorithm. And in this presentation, I'm highlighting the top part, which is screening. There are two options that the CDC recommends that you could consider for this first step of screening, and I will explain these more on the following slides. One method is simply asking these three key questions. Have you fallen in the past year? Do you feel unsteady when standing or walking? And are you worried about falling? These can be asked on a form the patient fills out electronically or on paper, or the questions can be asked verbally to the patient. If the patient says yes to any of these, then they are considered positive for fall risk, and you would go on to assess further what those specific risk factors might be. In other words, why are they at risk for falls? A caveat to the first question is that you will want to seek more details if they tell you they've fallen in the past year. For example, how many times have they fallen? Were they hurt? And under what circumstances did the fall happen? Was it a situation where almost anyone would have fallen, such as walking to your mailbox after a snowstorm and slipping on some ice? Or was it a pretty benign everyday activity that most people should be able to do, like getting up at night to go to the bathroom? If it's a fall like the ice example, but they say no to the other questions, then perhaps you don't consider them positive for fall risk, because that fall occurred in a situation where almost anyone would have fallen. If the answers to these three key questions are no, you will rescreen the patient annually and consider recommending some strategies to prevent future development of fall risk, such as making sure they're engaged in regular exercise. Another option for screening is a questionnaire that the CDC has developed called the Stay Independent brochure. This is also something the patient can do in advance of the appointment, either at home or in the waiting room, and again, potentially through a secure online portal. The brochure is freely available on the CDC study website through the link provided on the slide. This brochure contains 12 questions, and if they score at least 4 points, they're considered at risk, and then you would go on to assess for specific risk factors. Again, the why are they at risk for falling. If they score less than 4, but they've reported a fall within the past year, you again consider them to be at risk and then move on to a more thorough assessment. If they score less than 4 and report no falls within the last year, they're considered not at risk. And again, you might consider some recommendations to make sure they don't become at risk in the near future. Here is a screenshot of the questions on the Stay Independent brochure. Again, this is freely available on the link on the prior slide. If you scan some of these questions, you're going to see that some of them are going to start pointing the healthcare provider towards impairments that the patient might have to place them at risk for falls. There's questions about balance and leg strength, medications, and mood, which are all risk factors for falls. And so this particular method of screening begins to help inform what risk factors you might want to assess more thoroughly. Some pros and cons of these two options include the following. The 3 key questions is obviously very short and fast compared to the Stay Independent brochure. And again, this is something that can be done in advance of the patient appointment, either the day of the appointment in the waiting room or in advance at home. A drawback to the 3 key questions is that a yes to any question is going to prompt further follow-up. And there may be many patients who screen positive with this very simplistic screen. So it's going to trigger further assessment in many, many individuals. Another drawback is that it's not as useful as the Stay Independent brochure for starting to identify specific fall risk factors, because it does not get into the why whatsoever. Some pros and cons for the Stay Independent brochure include the fact that, again, these questions are going to start pointing the healthcare provider towards specific fall risk factors that the patient might have. This questionnaire, again, can be done in advance of the patient appointment. And the major drawback is that it's simply longer than the 3 key questions. So in summary, screening again is that very first step, and there were the 2 simple ways suggested by the CDC, the 3 key questions or the Stay Independent brochure. Whether or not a screen is considered positive is going to inform your next steps. If the patient is considered not at risk per the screen, again, you might recommend some steps that the patient might take to help maintain being not at risk. If they screen at risk, then you're going to dive into a more thorough assessment to figure out exactly why that patient is at risk for falling. So in review, screening is meant to be a quick snapshot of whether or not the patient is at risk, and the results of that screening, if they are at risk, is going to help the healthcare provider move to the need to do a more thorough assessment of specific risk factors. Again, getting at the uncovering of the why is the patient at risk. There are 2 simple methods of screening recommended by the CDC, the 3 key questions and the Stay Independent brochure, which is slightly more extensive. Links on this slide are going to take you to information I shared in this presentation. And this concludes the recording of fall risk screening. Thank you for listening.